name is Lisa Walke. I am the new Chief of the Division of Geriatric Medicine here at the Perlman School of Medicine. So I've heard about Penn Geriatrics for a while. I actually had looked at the program earlier in my career, and at this point to have the opportunity to come as a division chief and to continue the excellence that Penn Geriatrics has in clinical care and education and research was very exciting to me. I wanted to have the opportunity to continue to be part of the forefront of how geriatric medicine is taking care of older adults, but even more so now that geriatric medicine has a role in quality and patient outcomes and metrics, and so to be able to be part of an institution that is already a leader in that area is very exciting to me, and that's why I came to Penn. So one of my main goals is to foster, or strengthen rather, I should say, collaborations between the various entities that are involved in areas that relate to aging. So Institute on Aging, Penn Memory Center, their nursing school, I've heard there are individuals at Wharton. So anyone within the institution who has a focus on aging issues or perhaps in their own realm is working on improving the care for older adults, can we come together and have the collective wisdom of the group and strengthen our numbers to develop something really innovative and different for older adults, the complete wraparound in whatever area of care or research or education that they need, that we can form that kind of aging collaboration or aging collaborative at Penn that is so multifaceted that it really becomes the national leader of how we should be delivering academic care to older adults. I believe what's most important is for the public to know what the benefit of collaborating with a geriatric specialist is. Certainly you can have a geriatrician as your primary care provider for clinical care. You can also interact with geriatrics as a specialty for consultation if you're doing well with your primary care provider in internal medicine, family medicine, generalist, and you just want to have a focus on particular aging issues, how you can age better, or perhaps you're having some questions or concerns that you have and you want to explore that. That's where a geriatric specialist can help. I think there's a misperception that geriatricians only take care of nursing home or severely demented patients, perhaps people who are at an extreme of health. And while it's true that we do take care of people who are complex or have multiple chronic conditions or perhaps unfortunately have advanced disease in various different areas, and certainly that's a specialty area of ours. You don't have to be in that situation for a geriatrician to take care of you. And in fact, we're quite happy to work with people who are healthier and earlier on in the process to help them stay that way. Any older adult, regardless of where you are on the spectrum of aging, whether you're healthy aging, you want to stay there, or you're starting to have a few geriatric issues and you want to minimize them or figure out how to continue to optimize the health you have, Penn Geriatrics is a place for you. And then in terms of research, what people don't often recognize is that geriatrics is engaged in a wide range of research here and other places, but epidemiological research, aging basic science research. So all of that is also being looked at in geriatrics. Clearly Alzheimer's disease has a very vibrant research agenda both at Penn and nationally. So recognizing that geriatrics really spans the spectrum of clinical research, education, being involved with training medical students, residents, fellows. So just the wide-reaching aspects, particularly as we have 10,000 people a day turning over the age of 65 in the country, these skill sets are really needed in every area as we're having a more significant proportion of our population be over the age of 65.